I'm Jean Tiberio, and I'm a nutritionist and a wellness coach. Welcome to Healing Outside the Box. Today is episode 140, and I'm calling it It's So Easy Being Blue, What the Blue States in the Blue Zones Have in Common. Now, I may have to chop this into two parts, because I have a lot to say about blue zones, and I'll get into that eventually. And in part two, I'll also talk about how we maybe can make blue zones or maybe green zones in our own communities. But the first question is this: are blue states different in terms of wellness? Do we have less disease on a per capita basis if we happen to live in a blue state? The answer is yes. Now, there has been a lot of buzz in the media lately about potential changes in our healthcare system. These changes could affect all Americans in some way, but the most changes will come for the poor and the disabled in this country. And yes, if the healthcare bill on the floor of the Senate passes, and it's currently July of 2017, there will be changes to the SNAP or food stamp program as well. The SNAP program, more specifically the Supplemental Nutrition Assistance Program, may see $193 billion in cuts over the next 10 years. SNAP, in fact, will be targeted for the biggest cuts in Trump's proposed welfare reform. I'm going to quote you a couple of sentences from a CNBC article. I'll give you the link to this in the show notes. Quote, "On a per-voter basis, Mississippi and Montana, which voted for Trump, will be hardest hit by the proposed cuts in all programs like food stamps. Other red states will feel a big impact as well, and they are Texas, Arkansas, Louisiana, Oklahoma, Alabama, Utah, and Kentucky. The Trump administration's proposed budget would cut hundreds of billions of dollars in programs that heavily benefit voters in the states that supported him in the last election. The proposed cuts in Medicaid could total $610 billion over the next 10 years. That is a chunk of change. In that $610 billion figure, the biggest cuts will be health insurance for low-income and disabled people. And I am one of them there disabled people. But I'm fortunate in the sense that I have a big mouth and a microphone, and I plan on going down swinging. But I don't think I need to go down at all, because people all over this country are protesting to save my neck, quite literally. I've read a few articles on this subject, and I'll give you some links in the show notes. One of these websites is called nutritionadvocacy.org, and they have lots of information on that site if you'd like to read more about this subject. So the biggest hurt in terms of services goes to the red states. But what about the blue states? Do food nutrition programs like SNAP differ from state to state? You bet they do. Let's talk about Massachusetts, because that's where I happen to live. By the way, Massachusetts has the highest percentage of registered Democrats compared to the other 49 states. Maryland is a close second, I think. Massachusetts runs about 75% to 80% registered Democrats, but there are a lot of registered independent voters who almost always vote Democratic. I happen to be one of those independent registered voters, and I don't recall ever voting for a Republican. But I kind of like the idea in a democracy, like we have, hopefully still, that I can choose to vote for whoever I like. Now, you may not be old enough to remember, well, you probably will be, but before Obamacare was Obamacare, it was Romneycare. And it was Romneycare here in Massachusetts, and there was a mandate. Everyone in Massachusetts had to get some type of health insurance. The good news is that if you couldn't afford to be enrolled in one of the private insurance companies, Mass Health was always there as a big wide safety net. The SNAP or food stamp program in Massachusetts is funded under the umbrella of the Department of Transitional Assistance. In the spring of 2017, only a few months ago, residents of Massachusetts received a notice in the mail about something called the Healthy Incentives Program, or HIP. I know about this because I'm enrolled in the SNAP program in Massachusetts, and I received this notice in the mail myself. By the way, I get a grand total of $4 per week in food stamps, and I cherish it. I let it run for a while until it starts to add up, and I get all excited. But effective immediately, my $4 per week is going to be more because I spend my food stamp dollars at the farmer's market. Massachusetts residents getting food stamps are automatically enrolled in this HIP program, Healthy Incentives Program, accent on the word healthy. Basically, it works like this. If you use your SNAP benefits at farmers markets, farm stands, mobile markets, or community-supported agriculture, CSA programs, you will automatically receive up to $40 in additional food stamps. In other words, instead of getting less food stamps, Massachusetts residents will be getting more food stamps, and that has just started to actually take effect. So Massachusetts taxpayers are not paying more. They actually fall around 25 or 26 in the country in terms of income taxes, but they're getting more, especially when it comes to preventative health care programs. Compared to most of the red states, Massachusetts gets more health care screening for children, and you know that's really important if you listen to my episode on lead. They're getting more food stamps, more school and community vegetable gardens, more money for disabled children, etc. In this food stamp HIP program, farmers are contributing extra produce and extra prepared food in exchange for good PR and possibly subsidies down the road. Currently, the farmers markets, farm stands, etc. are called partner retailers. Out of the starting gate, the number of partner retailers in Massachusetts is somewhat limited, but that should improve over time. How it works is that the amount of extra HIP benefits will show up on your receipt when you purchase food at these places. The letter about the new Healthy Incentives Program gave us a phone number and an online link to check out the program in further detail. The SNAP program in Massachusetts also helps with recipes, cooking classes, and all this is free of charge to Massachusetts residents. Most states do not have these programs available, especially in the red states, or they may not be available to the same extent. Although this new HIP program is a national thing, my guess is that conservative states will not be that aggressive in getting the word out about the benefits to low-income and disabled residents. Might we guess the reason may be that it's a progressive, or dare I say liberal program? This progressive new program was led by Congresswoman Rosa DeLauro, who is a proud liberal from Connecticut. I actually met Congresswoman DeLauro for 5 minutes during a time when I was trying to get my bill proposal to improve the SNAP program going. I ran into her by chance one night when she attended the speech that was given by Elizabeth Warren in the next town over from me. Rosa DeLauro is one cool lady. Here's a quote from her website. Rosa is a leader in fighting to improve and expand federal support for child nutrition and for modernizing our food safety system. She believes that the U.S. should have one agency assign the responsibility for food safety rather than the 15 different agencies that lay claim to different parts of our food system. Well, amen to that. You guys who have been listening to my podcast know how I feel about the national food safety issue. Anyway, Congresswoman DeLauro works out of New Haven, Connecticut, but again, she was in Danvers, Massachusetts, attending Senator Warren's function. Way back in 2012, I had a few meetings with our then Congressman John Tierney about this bill proposal I wrote to improve the SNAP food program. John Tierney was at this Elizabeth Warren speech as well, and I got his attention to talk about my bill proposal. I also happened to have a copy of the bill proposal in my pocketbook, because you never know. John Tierney then introduced me to Rosa DeLauro, who was nearby. She gave me a big smile and a hug. I'm not sure if all this attention is because I happened to be in a wheelchair, but I planned on taking full advantage. I told Congresswoman DeLauro about my proposal to improve the food stamp program, and she told John Tierney, "Hey, send it over to my desk." Years went by. The seasons changed. They came and went. And I did hear a few rumblings during this time about adaptations and some discussion about SNAP improvements, but nothing public. That is, until I received this letter from the food stamp office in Salem, Massachusetts, where I live. What makes it different for us folks in the blue states is that everyone got this letter and people were talking about it. Also, it said that the HIP benefit was effective immediately, and it doesn't cost the taxpayers more money, as I've discussed. Okay, well that's all well and good, but what do blue states have in common with blue zones? The color blue for one, and I guess we could also say that they both have, well, a motivator. In blue states and in blue zones, a decent chunk of the population considers living healthier and therefore longer to be very important to them. Now, by no way do I mean to imply that people in red states don't consider being healthy and living longer to be important. I think, in my opinion, it's a matter of what priorities we may or may not put in front of it, either consciously or perhaps unconsciously. But I guess that's the point of these two episodes. Having a severe disability myself and being in a wheelchair for about, say, I think 27 years, I know how expensive it is to have a chronic disease. So maybe this is more about education. Now, again, I was going to go into some detail about blue zones, but I'm running a little long here with my stories, and it's certainly an important enough topic to have its own episode. But just for a little background, blue zones was a term first coined by a guy named Dan Buechner, who wrote a book about how people in certain regions of the world are not only living longer, they're also living better. Dan Buechner has now developed a following, and there is basically a movement developing regarding how perhaps the rest of us can adopt some of these lifestyles. You can learn more about blue zones on his website, which is basically bluezones.com. I'll also link it in the show notes. In the meantime, have a great week, enjoy the summer weather, and stay tuned for part 2 of It's So Easy Being Blue, the Blue Zones.